Covenant Health is a leader in obstetric care, creating an environment where parents are supported and babies are cared for. With 9,500 babies born at a Covenant Health facility, over 3,000 are born each year at the Misericordia Hospital. 1/3 of those infants will need some level of specialized care due to prematurity or medical complications.
We've been here for 5 days, and our baby was born on Saturday morning, and he was 7 weeks premature. We've been basically battling emotions the entire time we've been here. There's not much, we haven't had much time to just be a family, per se, and I think that's the hardest part for us.
Some babies arrive in the world with life-threatening illness, while others may just need a little assistance. Some of these little ones will only require a brief stay in hospital, while others will spend weeks or months in a neonatal intensive care unit.
We currently have actual space for 12 beds, but we run over most of the time. And so we have to condense all the patients and we put them very close to one another.
We already provide high-quality patient care to our little babies and their families, but we really are looking forward to having a new space, and it's much better benefits for our baby.
The Caritas Foundation is raising $2.5 million to help address the shortage of spaces in the Edmonton area by supporting the redevelopment of the neonatal intensive care unit at the Misericordia Hospital.
Over here we'll have the new family lounge. Right now they don't really have anything as far as a family lounge goes. So this area will provide guests, visitors, the parents, a place to come get away from the bedside for a little bit. Going down the rest of this hallway here, we'll have the more acute rooms. And so this is where the sickest babies will come, and also when they first come into the unit for their initial screening and their initial part of the stay.
So this would be the nurse's station here, where she'd have her computer and equipment so she can do her work to take care of the baby. This would be the baby station, where we'd have whatever equipment and be able to nurse the baby. And behind you there is the parent area, and that would where the chair would be, where they can do kangaroo care and cuddle their baby and have a bed to sit with siblings and store their belongings behind you. So as you can see, there's quite a bit more space to provide the best standard of care for our families.
I think something that would really help is just to be able to be together as much as possible.
And it's the most traumatic experience that a parent can have, is to have their baby ill and have to be separated from them. I brought you here today to the Grey Nuns to see the after picture. So what we are so proud to be able to offer is an environment where the room belongs to the baby. The nurses don't own the baby, the parents do. So we're visitors into the home of the baby and the parents.
There's a lot more room. We're able to have the cot in here, which makes it a lot more comfortable, whereas in the other rooms we had just the benches. I mean, you're given a lot of privacy. The kids are able to come and you're not worried about upsetting or disrupting any other families that are here as well.
We want to create a family-centered environment for care at the Misericordia through the redevelopment of the neonatal, one where babies and their families will be cared for in all aspects. So not only from the physical and the health challenges that these little babies have, but also to create a center where families feel welcome and where they feel they have time to bond and to respond to their young ones as they go through this challenge of being in the neonatal intensive care unit.
Covenant Health considers every detail, and every decision made is to ensure the best environment for babies and their families. This means creating and maintaining a place of compassion, hope, and healing. Babies thrive with parental involvement, an enriched environment, specialized equipment, and a highly trained team. We know life does not always start out perfectly for all babies and families, but caring for them in the right environment with access to proper care services will give them the best chance at a healthy, happy life.